Hello, I'm Dr. Mark Pearson. I work as a consultant psychiatrist in psychotherapy at Birmingham in England, which means I trained first of all in medicine, then in psychiatry, and then specialised in psychotherapy. I wanted to talk to you today about the idea that things we are unaware of, which are called things we are unconscious of, can profoundly influence us and maybe even produce some of the symptoms that trouble us. The idea that we are unaware of quite a lot of our experience is familiar to all of us. At the moment I'm looking at the camera, but I'm aware of things to the side of me. And these are things that are fairly trivial. There's just too much information, I can't be aware of all of it. And those are not the sort of things that we're interested in. We're interested in things which we may actively force out of our awareness because they're too difficult or traumatic for us to think about. Now, I don't want you to necessarily be convinced that this is the case. It's a controversial topic, whether we are profoundly influenced by things that we're unaware of, but I'd like to give you some pieces of evidence that this probably is the case. The types of awareness I'm talking about are partly things which occur in the first 5 years of our life, and if you think back to your earliest memory, I think you'll probably find it's something like the first day you went to school. These are things that begin about the age of 5, and clearly a lot has happened to us before 5, which affects our personality and probably particularly the way we make relationships with other people. Those first 5 years of life were dependent, and yet we're having to relate to our caretakers, usually our mums and dads, whether we like it or not. And this means that for better or worse, we've established patterns of making relationships which we're largely unaware of. The second type of thing I want to consider are things which we might call traumatic events. Perhaps the easiest one that everybody recognises is when soldiers have been to war, they've had and seen things which are really quite horrific, and when they come back from the war, they often suffer from a condition we now call post-traumatic stress disorder, which means they can become very anxious, and sometimes they're not aware of the triggers, the signals that cause this anxiety. So, for example, they may hear a loud noise, a car backfiring, and almost have a panic attack. They may be aware that that reminds them of a bomb exploding or gunfire, but they may not be. And this, you can see, is a prototype for the idea that people can have quite severe symptoms, perhaps particularly symptoms of anxiety, which arise from problems which they're unaware of. And the idea of exploratory psychodynamic psychotherapy is that people can be helped to become aware of these things by being in a relationship with a therapist, or by thinking and analysing their own dreams, or by being aware of slips of the tongue and sometimes becoming aware of things which seem they don't quite understand. And perhaps if we think of an example of somebody who's maybe been traumatised in their early childhood, the sort of things we might be thinking of are going into a certain room with the curtains drawn, the colours of certain walls, the wallpaper. These can act as triggers and make people anxious to an extent which they know is out of proportion to the things that they're seeing. There's one other bit of evidence I'd like to give you in favour of the idea that people are influenced by things out of their awareness, and that's the phenomenon of hypnosis. Freud, who's the founder of psychoanalysis, noticed that people could be profoundly influenced by suggestions that are made, and I think we see it now in the stage hypnotists, people like Darren Brown, who can implant an idea, a thought in people's mind, that they will become sleepy, say, or find the taste of something they normally find agreeable deeply unpleasant, and this can be brought on by a word or a trigger that they say later on, and people find to their great surprise that they can't drink their glass of water. It does actually taste disgusting, and this shows that their emotional state, including sort of their preferences, their likes and dislikes, can be influenced by things, and they didn't know where it came from. Hypnosis has quite an important part to play in the whole history of psychoanalysis, because it's both evidence in favour of a dynamic, unconscious motivation for things, and it's a problem to us, because if people are suggestible, and most of us think we aren't, but why do we have the advertising industry and various attempts to make us buy things which we don't necessarily want? So if we accept we all are suggestible, there is a problem that we can have ideas implanted in our minds, and I want you to be cautious as you listen to me and think, well, do I actually agree with Mark Pearson, or do I not agree? I'm concerned not to convince you of things that you don't want to be convinced of. But this is something that I believe in, and I've found in the course of my professional work does happen. I wanted to give you one rather dramatic example of something which we call repression, which is a sort of forced and motivated type of forgetting, but which occurs without people realizing it occurs. I once saw a man who had very unfortunately been given a diagnosis that he had lung cancer, and this was a serious cancer, and his prognosis was really quite poor. But people became slightly worried because when he came away from seeing the doctor, he seemed to have no knowledge and carried on blithely as if he didn't know this fact. And in fact, when they questioned him, he said the appointment had gone well and he hadn't been told anything untoward. By the time I saw him, I noticed that if you talked about doctors or appointments with specialists or his smoking, he grew very anxious, but he didn't seem to know why. And this presented us with a problem of how to make him or help him become aware of some information which he really needed to know, because he needed some therapy for his cancer. And you can see that this had to be done tactfully, because suddenly becoming aware of something as traumatic as this was quite difficult for him. And this is something you might want to consider. It's quite likely that most of us do have traumatic events and events in our early childhood that do influence us, but it won't be that easy for us to recall them, because we've deliberately, or not perhaps consciously, but automatically forgotten or repressed them. And this is the idea of a dynamic, repressed unconscious, something which influences us, it's dynamic, which we've forgotten about or decided that we really can't process. And it's how we become aware of these things so that we can then more consciously take steps to deal with them that is at the heart of these talks that I wanted to discuss with you today.